As the oncology nurse navigator, I do touch the patient very early on. Once they get on their targeted agents or their immunotherapy or their chemotherapy, if they need me, they know they can reach me, or I'll see them in the infusion area. But I do try to explain and prepare them that, you will have your chemotherapy and radiation for approximately 6 weeks. Then we have to wait, a little bit, and then the doctor will do another scan, and then maybe you'll go on the immunotherapy. So I do try to prepare them that this is a journey, and that we have turned lung cancer into a chronic disease, just as if they had diabetes or if they had congestive heart failure, so that this is something that is going to be in their life, and that we are all here for them during the journey. So I just prepare them that this is a long haul, and the lung cancer is a chronic disease now.
I usually am able to interface with my patients approximately 1 or 2 weeks after they've been newly diagnosed. At that time, when I introduce myself, I like to remind them that the treatment that they're going to undergo, it's like I actually have a roadmap, and it's got a road, it's got and it gives them the information that I'm with them throughout their journey with cancer. So if they have a roadblock with maybe side effects, I'm there for them. If they have a detour and their treatment has to be put on pause, that's all right. We'll eventually get back onto that treatment and be able to proceed further on. I love to be able to explain to my patients that their treatment, really and truly, this is not a sprint. This is a marathon. And you're going to have to take the mind of, I'm training like an Olympian would. It's going to be every single day that you're going to get up and focus on doing the best thing for themselves in their day-to-day care, and then for definitely showing up for follow-up appointments and for all of their treatments. That is encouraging to them and does give them the right perspective that this is a long-term commitment that we're going to be making to be working together.
I suppose the first piece is that it depends on their stage. So we spend some time talking about the stage of their cancer. That's often one of the first questions they'll ask, what stage am I? And so depending on their staging, the advice will vary. The majority of patients that I see have stage 4 cancer. Not all, but I'd say most of them. And so that's a very different conversation than someone who, has an early stage cancer, and I'm trying to coach them through, a prep for surgery and what surveillance is going to look like, or a locally advanced patient who we have to talk about, the trial of chemoradiation followed by a year of immunotherapy. And that's different than, if we know that this is something that's ultimately terminal and that treatment's going to be palliative. And so because I see mainly metastatic, I think it's important at that initial visit to be clear about the stage of the cancer. I always try to, not just remind them, but interject hope. Hope that they can, continue to live well with cancer, and that we're going to be there to support them along the way. But I think it's important to be clear about the goals of your therapy and what your expectations are. And so we spend a lot of time trying to do that up front.